We'll go now to our reporter, Laura Windsor, as she asks questions about a condition called eczema.
Eczema is also called dermatitis. It is not serious, but most types cause red, swollen, and itchy skin. We asked Dr. Timothy-Jochen of Desert Regional Medical Center in Palm Springs about this most common skin problem and the treatments currently being used.
Eczema is inflammation of the skin. It comes in a triad. People have eczema, asthma, and allergic rhinitis commonly. So they come as a triad. Eczema is just red, scaly, inflamed skin. You can have blisters on your skin, but typically it's just red and scaly. With eczema, there are several aggravating factors. For example, extremes in temperature or humidity can aggravate eczema. Also, things that are rough can aggravate eczema. For example, if you wear wool clothing, sweating can make it worse. If you're exposed to things that are irritating to the skin, for example, harsh detergents and cleansers can irritate it as well.
Dr. Jochen explains who is prone to eczema.
Typically, there's not, men or women are not more likely to have it. It's pretty much equal among the sexes. It affects all races, and it can be very severe. Typically, as you get older, it gets less severe, but in my practice, probably 25% of my patients have some form of eczema.
We asked Dr. Jochen about how eczema is treated.
Treatment for eczema, first of all, is to keep the skin well hydrated. So we want to moisturize the skin all the time. Also, when you're cleansing your skin, you want to use a gentle cleanser. Some of the ones that I like are Dove, Cetaphil, Purpose, Eucerin, and there's a new one called CeraVe. So we want to use a gentle cleanser. We want to moisturize the skin. If you start to see flares, what we do is we typically will use a topical steroid. And with this, that'll help to cut down on inflammation. There are also some non-steroidal anti-inflammatories that we can use, such as Elidil and Protopic and things like that. For severe cases, we have to do things like light treatment. We may have to put people on immunosuppressive agents like people who have rheumatoid arthritis or other autoimmune diseases.
We asked Dr. Jochen, can children contract eczema?
In children, typically it's going to be in infants, it's going to be on the extensor surfaces. And by that I mean areas that they're rubbing against, for example, on the elbows and knees. Whereas as you get older, it goes to the flexor surfaces. That's like the creases in the arms, the creases behind the legs. You can see it around the eyes, you can see it on the neck. You can basically see it anywhere on the body. The problem with eczema is it is so irritating for people because it's so itchy. It drives people crazy. But when you start talking about some of the more dramatic treatments that people have to do, for example, immunosuppressive agents, they start to go, maybe I can just live with this. But I can always get people clear if they're willing to undergo more extreme forms of therapy.
Any kind of skin condition should be treated promptly, especially eczema. After all, your skin is your largest organ and your first barrier of protection against the elements. I'm Laura Windsor for the American Health Journal.